We are so delighted to welcome Mr. Edward Park. Then could you please introduce yourself?
Okay, so I work as a nurse educator at Mount Sinai in New York City. hmm So I've been a nurse for about 31 years, but been an educator for I would say about 10 years. hmm My background is in critical care, and mostly in cardiovascular critical care units. But I had an opportunity to work in different units as well as I work together with my other educators. I had an opportunity to cover different floors. So I uh, did have an opportunity to cover some step-down units and medical surgical units and some oncology units as well.
Thank you so much for sharing your rich experience with us. I'm curious to know, from an educator perspective, how do you think nurses can overcome this challenging time during this COVID 19 pandemic?
Yeah. I think, because with the vaccine, there's a light at the end of the tunnel. I think as nurses, if nurses take an active role in leading vaccination, I think it'll be much quicker. That we can get back to the way we were. But looking at the current rate of vaccination, I think it may last a little bit more than we expected. Yeah, what I see now is happening in the New York City area, and I'm not sure how it is in other regions or country or globally. But many nurses are hesitant in taking the vaccine, which is very worrisome because really we should be the role model for the rest of the society. And if nurses are hesitant in taking this, I'm not sure what kind of message we are giving to the rest of the people in the country. Um, I try to figure out is it what is causing this hesitancy, should I say? Unfortunately, I think some of it is uh, conspiracy thinking, and some of it may be due to, well, for some of the nursing workforce, it may have to do with historical context where certain minorities were not treated fairly in healthcare field. But I think we have to move beyond that now and really adapt the science and appreciate the science, and they have done tremendous work. And from educator point of view, I'm trying to figure out what part of learning has not taken place where people are so hesitant. Is it the knowledge or is it the attitude? And the first thing that comes to my mind is I think in nursing, you got to have a more robust scientific prerequisites in order for nurse to uh, fulfill their duty as a healthcare provider at a higher level, right? So when I look at the prerequisites for a nursing program, I know the general chemistry and maybe basic biochemistry, some biology and physiology, and some basic algebra, I think. And I'm just thinking, should we increase the bar so that people who think more scientifically or who is able to pass a more rigorous scientific undergraduate courses will be able to progress to nursing. And if we compare this to, let's say, physical therapy, pharmacy, or physicians, I think there's a huge gap between nurses' prerequisites and their prerequisites, I think, right? And I often see a lot of doctors, residents, and fellows that are lining up to get their shots. And I think their percentage of vaccination is much higher compared to nurses. And I think in order to close the professional gap, and I think if we insist on being an equal partner with physicians, I think we have to talk the talk, but also walk the walk. Okay.
Thank you so much for bringing that out.
Yeah.
Then, working as a nursing educator, like what is something that you always keep in mind when supporting nurses?
Yeah, right now I think because we are under stress, staffing wise, very severely short staffed nurses, and also emotionally and socially stressed because of the COVID. And I'm sure they have family obligations, as well as a lot of nurses are in school for their graduate degree. So they have a lot of competing needs. So there may be some area that needs to be improved. But I think from educators' point of view, we have to make sure that we don't push them too much or expect too much out of them at this time. And I think COVID not only affects patients directly, but I think it affects the other aspect of nursing care. I'm sure it does the same thing for medical care as well. Yeah.
Yeah, I totally agree. Like mental well-being is really raised recently due to this COVID pandemic.
Yeah.
Um, so my third question is like, what do you think nurses' roles will be in the future, like post-COVID-19 era, from your thoughts?
Yeah, I think especially for critical care nurses, I think there hasn't been heightened awareness of how valuable ICU nurses are. And I think I really appreciated the way the mass media is portraying nursing, especially critical care nurses. Still not quite accurate. They don't still fully portray nurses to their highest level that they are. But I think society in general really appreciate nursing and critical care nursing, not just for their skills and education, but also their willingness to sacrifice themselves. There are a few nurses who do quit because in order to avoid. But I see many, especially older nurses in their 50s and 60s coming to work when they don't have to. They could have just retired. So I really think this is a good opportunity for society to see nurses as a caring people, and the way caring, the the traits of caring should really be elevated above um, financial gains that we value so much here as a capitalistic society, right? Yeah, and I hope they don't forget this soon. And I think as a nurses, we have to continue to demonstrate and uh, work together to portray positive image of nursing in general. And I think, yeah, with that, I think nurses can be participate more in leadership positions and leading healthcare changes.
Mm.
Yeah.
Thank you. I've seen in the news like many nurses from outside of New York came to
Uh-huh.
help and assist, and also as you mentioned, like many nurses who have retired came back to the workforce. From your just thoughts, what are their like motivation or like passion to come and return to the workforce? Do you have
Yeah, yeah, I'll be just very honest. So I think there are nurses who come to New York City from other part of the country, uh, motivated by altruism and caring. And there are many nurses who come here to make big bucks because they're paying quite a bit of money, unheard of money for younger nurses who may be at a low risk. So we have quite a bit of nurses moving in and out in order to be rewarded for the skill they have. So I think um, we should appreciate the nurses who stay on or come back from retirement, but there are some nurses who are in for the money as well. But I think we should appreciate their skills and reward them accordingly. And they do that in other professions. And I think it's about time that nurses get recognized.
Thank you.
Yeah.
Then could you give us a message to nursing students and nurses who will become the future leaders who are watching this clip?
Yeah, so I think before you advance to advanced practice nurses, just as NP or CRNA or maybe nurse educator, you should really become clinically competent and become an expert in your area for several years before you go back to school to pursue your degree. because I think although this, we the NPs function at a similar level as some of the physicians, I think in order to be fully appreciated and supported, I think you have to bring a little bit more to the table. You got to have a clinical expertise uh, beside knowing the theoretical foundation and research. And I think in order to be safe and effective NP, CRNA, I think a good clinical knowledge and skill is important. And I think this is how we elevate nursing and become equal partners with the physicians. And I think bedside uh, is very rewarding if you find your niche. So really try to find a way to love bedside nursing. And I think some of the responsibility falls on administration to reward them accordingly. But I think by joining some of your specialty organizations can help you become fully appreciative of your specialty area and the impact that you make on your patients and families.